Good afternoon. My name is NParmenter, and I am really happy to be with you here this afternoon. We're going to spend the next few minutes just reviewing something that you already know, and that is delegation and prioritization. This is something that you have certainly had as you have gone through your courses, but sometimes it's buried a little bit and we don't really emphasize it as much as we do. So I want to do a quick review just to share with you some of the high points for what it would be for you to work in terms of when you delegate and how you prioritize. So how I'm going to do this is I'm going to read the slides, I'm going to read your answers, and we're going to talk about what the right answer might be and why. We'll start with, before we start, what I'd like to do is remind you of something we talked about this morning, and that is the stop sign. So who here could tell me what the S stands for? Thank you, Charles. Yes, you're absolutely right. S means story. We want to know what the issues are. We want to know what the background is and why is this affecting the client the way it is. Terry, could you answer, do you know what T stands for? That's correct. T equals think. And so here's where you want to identify the keywords that are found in the stem of the question, or something that, what type of question is it? Is there just one answer? Are there multiple answers? Is there something that we need to know more? Who wants to try O? Thank you. Absolutely correct. O is options. Consider what your choices might be for how you would answer this question. And way over in that far left corner, P. Right. P equals pick. That you just want to pick a correct answer. Now, in some cases, and as we're going to go through here in a minute, you're going to have more than one correct answer when the question is select all that applies. But for the most part, once you choose an answer, don't go back and change it. It's been noted that usually your first impression is the correct one. Okay. Going forward, stop me if you have any questions, but I want to just run through different types of questions with you and talk about some of the rationale as it relates to delegation and prioritization. I'm going to read the question and read the answers, and we'll talk about and discuss why the correct answer is what it should be, why it might be that. So the first question is one of those favorite ones I know you really enjoy, and that is select all that apply. Now, in a select all that apply, we know there are at least two correct answers. Sometimes you're going to have four. Usually you're going to have five choices in that. A nurse cares for a client with a terminal lung cancer. Which action should be delegated to the assisted personnel, or AP? Select all that apply. Encourage the client to express feelings about a terminal diagnosis. Assist the client to ambulate to the bedside chair twice a day. Demonstrate to the client the proper use of bronchodilator inhaler. Complete vital signs that include oxygen saturation every 4 hours. Or obtain a urine specimen from a client's indwelling bladder catheter. Okay, select all that apply. Number one, would encouraging a client to express feelings about a terminal diagnosis be assigned to an assisted personnel? Well, we really haven't done a quick review, which you talked about this morning, but what does an assisted personnel do? Exactly. They take vital signs, they do INOs, they are non-licensed. So when you would talk about the nursing team, you want to remember that the assisted personnel, and they go by different names in different organizations, they can be called a CNA, a PCA, a nursing assistant. The common thread is they are not licensed. So would expressing feelings about a terminal diagnosis? Probably not. That's not something you want to have an assisted personnel do, because that person is experiencing grief. And there may be a need for more assessment. There may be a need for additional interventions, maybe a call to a provider. But bereavement and at that level is not something you want an assisted personnel to be dealing with. How about assisting a client to ambulate to the bedside chair twice a day? Absolutely correct. Yes, that is well within the scope of an assisted personnel because it is dealing with a stable client that is doing an activity of daily living, and that is within the scope of the assistive personnel. Demonstrating to the client the proper use of a bronchodilator inhaler. Now, there's a couple of keywords here. That's correct. This is teaching, and that would not be something that you would have an assistive personnel do. Teaching is under the RN scope. And so no, that's not something we would want to delegate to an AP. Complete vital signs that include oxygen saturation every 4 hours. Yes, we've already said that taking vital signs is something that the assistive personnel can do, and it is within their scope. And how about obtaining a urine specimen from an indwelling bladder catheter? Marion? Not really, because, because that is going to be a closed system, and you're going to be taking a sterile specimen, which does not come under the scope of the assistive personnel. So, correct answers in this case are number 2 and number 4. Okay, let's try another one. A nurse cares for a group of clients on a medical surgical unit. Which client should be delegated to the PN? Now, the PN is the practical nurse. What do practical nurses do? They reinforce teaching. They can help with medications that are not initial doses. They do care for chronic, stable clients. So which client should be delegated to the PN? A client with a newly diagnosed diabetes mellitus type 2, facial lacerations and subdural hematoma, bronchitis receiving a bronchodilator treatments, exacerbation of the myasthenia gravis admitted 3 hours ago, or advanced regular diet 2 days post-op for a cholecystectomy. Okay, this is another one. Select all that applies, so right off the bat, we know there's more than one correct answer. How about number 1? Newly diagnosed diabetes type 2. Again, no. The practical nurse will not get an acute, newly, and here's your keyword. Remember when stop sign? Think about your keyword. The keyword in this case is newly diagnosed. So that would be an RN's responsibility, not a practical nurse. Facial lacerations and subdural hematoma. Anytime you have a head injury, you need an RN to do that assessment. There may be sudden changes. This again is a very acute, unstable situation, so it would not be for the PM. A bronchitis receiving bronchodilator treatments. Yes, absolutely. This is a patient that is stable. Doesn't say anything about new or ongoing. We can assume that it's ongoing. It's not initial. Those keywords are missing. So yes, this would be something that the PN could absolutely do. Could be delegated to that level of care. And advanced regular diet post-op for a cholecystectomy. Absolutely, Susan, thank you. Yes, because 2 days post-op chole, we're probably thinking about discharge. And that would be when you would logically then do the advanced diet to regular for that. Okay, let's do one more quick review and of the different, now that we've already talked about the 3 different levels, the AP, the PN, and the RN. This side of the room, give me what are some of the skills for the AP. Thank you. ADLs, vital signs, INOs, safety, weights. Middle of the room, PN. Stable client, data collection, reinforce teaching. That's last side of the room over there. Unstable client, new teaching, assessing, learning, and doing plans of care. So, in fact, to review this information more fully, there is a worksheet, I believe, on page 13 and 14 in your notebook. Take a look at that tonight, because this will give you a little bit more practice on which tasks go to which level of care. Okay, moving on. A nurse assigns 4 clients to the PN. Which findings should the PN immediately report to the nurse? A client who is receiving long-term IV antibiotics who has a rash in his left groin. A client with a baseline regular apical pulse of 88 who has irregular apical pulse of 120 today. A client who has a recent diagnosis of terminal cancer and refuses to eat or participate in hygiene care. And a client that's 8 hours post-laparoscopic surgery who reports abdominal distension and shoulder pain. Now, what's the first thing you notice about this question? There's only one answer. So we got one choice of these four. Do you think that it would be important for a practical nurse to report this to an RN for a patient that was receiving long-term IV antibiotic and had a rash? No, that's correct, because a rash is likely to occur when? Usually immediately following the initial dose. Sometimes it can be up to 24 hours, but usually it's within a short period of time. So the question is long-term. This patient's been getting this IV for long-term, so the rash may have absolutely no relation to the IV medication. It could be a yeast infection. We don't know. But at this point, no, it's not. So think, if you want, for things that need to be reported, the key words to think about are acute and unstable, unpredictable, those sorts of things. Number two, with a baseline where you have an apical pulse that's changed from 88 to 120, and it's changed from regular to unstable or irregular. What do you think about that? Yeah, now we have all of the key words here. We have the number changing from 88 to 120, so we have a baseline. Clearly it's greater than the baseline today. We also have something that was regular and is now irregular. So definitely a good possibility. Number three, someone who had a recent diagnosis of terminal cancer and is refusing to eat or participate in hygiene care. Well, again, that is pretty typical, isn't it? We sort of expect that when people are grieving. So that people grieve in different ways, but this would not be something acute. This would be something that needs to be dealt with, absolutely, but not immediately reported. And then number four, a patient who has post-laparoscopic surgery and is reporting an abdominal distension. Is that normal or not normal? That's a very normal finding. And so it's almost an expected sign, because you get gas where you have the surgery, you get referred pain into the shoulder, and that you're going to be uncomfortable. This is not to say you're not uncomfortable, but it would not be something that would have to be reported immediately to be dealt with. Okay. Good answers. Let's keep going. Couple more. A nurse plans to administer the following medications. Which medication should the nurse administer first? A scheduled IV antibiotic for a client with resolving pneumonia. Pain medication to a client who rates their pain on a 4 to 5, they rate it 4 or 5 on a 0 to 10 scale. An antidiarrheal for a client with 1 diarrhea stool in the last hour, or an antipyretic to a client with a temperature of 100.7. One answer. What about number one, a scheduled IV antibiotic for a patient with resolving pneumonia? Yes. And why is the IV antibiotic the one that the nurse should administer most? Because if you look at the rest of these options, we really need to maintain a therapeutic level of whatever the antibiotic is for this patient. The pain medication on the scale of 4 to 5 is probably not acute. I mean, they're uncomfortable and they're not feeling very good. But even if you have a 4 to 5, you would be getting a pain medication that's going to take probably 30 minutes or more to kick in. So it is critical that we maintain the therapeutic level for the IV patient. Now, most hospitals allow you to give the meds 30 minutes before to 30 minutes after the given hour, but you do need to stay within that window. And antidiarrheals for a client who's only had 1 diarrhea stool in the last hour is probably not critical, correct? What do we worry about when we have patients with diarrhea? We worry about dehydration, but that's not as acute at this point as keeping the therapeutic level at the IV antibiotic at the therapeutic level. And then the patient with a temperature of 100.7, is that a critical level? No. What is a critical level? Critical level is 104 or above. If the patient was 104 or above, yes, that would bounce that up immediately to the critical side. Okay, one more, and then we all take a break. After receiving morning report on the adult medical unit, which client should the nurse assess first? A client with acute glomerulonephritis with a urine output of 160 milliliters total on the prior shift, or a client with a bubbling in the suction control chamber of a closed chest drainage system, a client that's 3 days post-op for left mastectomy who is tearful and withdrawn, or a client with a wound infected with MRSA who wants to leave against medical advice. Okay, how about the client that has a total output of 160 prior shift? Now, you realize they don't tell you how long the prior shift is, so what are you having to think about in terms of how are you going to just determine if this is a crisis or not? Thank you, Tom. Yes, that's correct. What we do is an average of 30 milliliters per hour for an adult client. And so if the shift was even 8 hours, the patient is still under. If the shift was 10 hours, they're even further under. And if it was a 12-hour shift, they're in severe problem in terms of lowered urine output. Most often we don't, and this is also probably a fairly sick patient. This could be the first sign to kidney or renal failure because the patient could have had a streptococcal infection earlier and they could have some filtration rate problems. Anyway, this one is a very critical finding. What about the client with the bubbling suction control chamber? Well, the bubbling is what we want. It's when it doesn't bubble is when we get a little bit anxious. So if you have a closed system that's not bubbling, you can remember that's indicative of maybe a kinked tube or something because the negative pressure then is not being held against that chest wall. The client that's 3 days post-op for a left mastectomy who is withdrawn and tearful is absolutely expected. Again, this is grieving. They've lost a body part. They're having to come to grips with probably some kind of terminal, possibly a terminal diagnosis, and they're going to be in a very tearful state, and that would be normal. And then lastly, how about the client who's got MRSA who wants to walk out of the hospital against medical advice? Well, although it's not recommended, that's not going to bump the physiological findings of our patient with the decreased urine, because that one is a physiological finding that is much more urgent to deal with than the client who wants to leave. Thank you for your answers. You know what? I think you guys deserve a break. So take a break now and be back at the top of the hour at 3 o'clock, and we will tackle the rest of today's. Thank you.